Good afternoon. My name is Melissa, and I will be your conference operator today. At this time, I would like to welcome everyone to the Person-Centered Transportation Information to Older Adults and People with Disabilities conference call. All lines have been placed on mute to prevent any background noise. After the speaker's remarks, there will be a question and answer session. If you would like to ask a question during this time, simply press star, then the number 1 on your telephone keypad. If you would like to withdraw your question, press the pound key. Thank you. I would now like to turn the call over to Ms. Virginia Dawes.
Thank you, Melissa. We really appreciate it. Good afternoon, everybody, and welcome to today's webinar, which is hosted by the National Aging and Disability Transportation Center. Today, we'll discuss how to provide person-centered transportation information to older adults and people with disabilities. I'm Virginia Dawes, one of the co-directors of the National Aging and Disability Transportation Center. I'll begin with a few housekeeping details. That's the next slide, Ken. Closed captioning is available for this webinar, and I'd like to thank our captioner for being with us today and providing this valuable service. To access the captioning, please press the CC icon at the top left of your webinar screen, or using your computer's keyboard, press Control plus F8. A separate captioning window will pop up that you can customize. And you can resize the captioning window so that you see the captioning and the PowerPoint presentation at the same time. If you're having any difficulties with Blackboard functioning, please contact Blackboard directly for technical assistance. The phone number is 877-382-2293. This webinar is being recorded and will be archived on the NADTC website. The archive will be available on the NADTC website in the next week or two, but the PowerPoint is already available at our website address, www.nadtc.org, in case you haven't already accessed it. Can leave it on the first slide because we'll go back to that. We welcome questions at the end of the webinar. In addition, we've already received a number of really good questions that were submitted by the participants. We noted as we were talking with our speaker, Roberta Habowski, that a number of those questions are going to be answered by her really during her presentation. As the webinar gets underway, if you have a question, you can post it either in the webinar chat box at any time, and then the operator will also be providing, for those of you who are connecting by phone, instructions after the end of Roberta's presentation that you may submit questions by phone. So when it's time for the questions, we'll be giving you those additional instructions on how to ask your questions that you may have. We'll also answer as many questions as time allows, including questions that were pre-submitted. If we don't have time to answer all your questions, never fear, because we will follow up after the webinar. Now, you'll see that the slide up on the screen is about the NADTC, and I'm assuming that a lot of the people on the phone and on the website joining us today already know about us, but just as a reminder, our focus is on accessible transportation for older adults and people with disabilities and caregivers. And our real focus is accessibility in its broadest sense, not just paratransit accessibility, but anything and everything that makes transportation easier to access. including the topic that we're discussing today, which is information and assistance, and how to ensure that people living in the community are able to access the information that they need. I do want to point out that we have some exciting upcoming events that are going on. Our 6 NADTC grantees have been working away, and they've now finished half a year of work. So we will soon be publishing on our website an update on some of the innovations that they are engaged in. We'll also be doing in the fall an online mini course on transportation and caregiving. And right now, I'm sure if you get our e-news, and I hope you do, you'll see that we are publishing spotlights from our 2016 Trans Report, and we're getting ready to work on our 2017 Trans Report, which we're very excited about. I also want to remind those of you on the phone who work in rural areas, and we know that many of you do because of some of the questions that we got, that there is an important conference coming up in October. The 3rd National RTAP Technical Assistance Conference will be held in Omaha, Nebraska, October the 29th through November the 1st. I do want to say a couple of things about what NADTC is doing about information and assistance on transportation. First of all, I want to recognize the fact that we think of information and assistance as a variety of things that communities can do. We know that many communities don't have all these resources, but some do, and it includes things like a one-call, one-click transportation resource center, mobility management, aging and disability resource centers, many of whom are very expert about the transportation available in their communities, as well as the information lines that are operated by area agencies on aging and centers for independent living that serve a number of very wide variety of needs, that also, in many cases, offer transportation information. And finally, many local communities are served by 211, and that's also another resource that many people can use. So with that, I'm going to introduce our presenter. So Roberta Hrabowski is the Mobility Project Manager with Area Agency on Aging 1B in Southfield, Michigan, which is just outside of Detroit. She's got over 15 years of experience working with older adults and mobility issues, including alternative transportation, driving education and cessation, and other mobility resources. At AAA 1B, she manages the My Ride 2 program, a one-call, one-click mobility management service where staff assist older adults and people with disabilities to find transportation resources in the region. You'll hear more about the My Ride 2 program today in the webinar. So welcome, Roberta. We're very pleased to have the opportunity to turn the webinar over to you now.
Thank you, Virginia, and welcome everyone. Thank you for attending today. And I hope that I can give you all the information that you needed. And if not, as Virginia said, you can certainly contact NADTC or myself, because I'll give you my email address at the end. I decided to title this presentation, The Evolution of My Ride 2. In order to get where we are today, we had some background activities, so I'm going to talk about those. In 1995, our advisory board conducted an ad hoc study regarding the lack of resources for older adults making decisions. They noticed that there was an increased need for that, and they wanted to document that and have further studies on that. So in response to that, the You Decide Feed Your Driving Awareness program was developed. And this program met monthly at various senior centers covered a variety of topics, including safe driving, medications in driving, transportation, road commissions. We did map reading. We had the licensing, driver's licensing, state person come in and talk about licensing procedures and misconceptions about that. So it's really a wide variety of topics that were covered. And after that, we developed a mobility options counseling project, which was sort of like the monthly meetings, but condensed into a half-day or one-day format. And we took that on the road, so to speak, and did it at various senior centers. Throughout that time, we had various funders, our Michigan Department of Transportation, our Office of Highway Safety Planning, our Community Foundation, and these were all just little smaller grants that we did what we could with at the time. There were also other organizations that were trying to get information all in one place. They made up booklets, they had things published, but by the time that they published and sent out, everything, not everything, but a lot of things were outdated. And not everyone had access to those books. Our CEO at the time, and she was ahead of things, she said there needs to be one place that people can call and get information instead of sending them, looking for all these different things on their own. So all of these things made us even more aware of the need for transportation and the need for people to find that information. Next slide, please. Oh, and I don't know if that's
maybe the next one.
Slide 3. Oh, I don't know how there we are. Okay. All of us, we discovered this, and hopefully everyone on the call knows this, and if not, here's this information. All of us, including all of us on this call today, are going to outlive our ability to drive by 7 to 10 years. And that's actually probably getting longer with our longevity increasing. And one thing that really, really resonated with us is this quote from one of the Senior Driving Awareness Program participants. If I can't drive, I might as well be dead. And that is a direct quote from a participant. Clearly, people need to know that there are options available, and they need to know how to access them and how to use them. Next slide, please. So this one is called Getting Ready. I don't see it on the screen. There we go. So the next phase happened in 2010, and we had partnered with Jewish Family Service in our area throughout the years on a variety of activities, senior collaboratives, housing initiatives, a lot of different activities related to seniors. So in 2010, Jewish Family Service, who also provides transportation, asked us if we would like to partner with them to apply for the Job Access Reverse Commute, or JARC at the time, and News Freedom federal funding. And as far as we were aware, this was the first time mobility management was offered as a component. So Jewish Family Service came to us, and we applied together to our the pass-through or receiving agent of the funds, which is our local public transportation provider. JFS also offered to be our fiduciary free for 2 years, which was wonderful, and it sort of got us on our feet. Now we use 5310 funds, and we apply on our own. And over the years, we have also had various other grants that have supplemented, enhanced, allowed us to save a little bit of our money and keep everything moving longer. We received a grant from, right now, one from NADTC, which I'll tell you what that's for in a little bit. Well, I can tell you, it's for travel training. We received money from Transit Planning for All, the FTA, and Community Transportation Association of America, and other partners. And oddly enough, we received some money from the Michigan Fitness Foundation, but they were interested in how people can get out and do things in the community. So all those little grants have supplemented everything that we were doing. Next slide, please. So development. We spent 1 year of research and development, and at that time, I was the only employee on this, and I was the only staff, and I was part-time. So 1 year, we had to decide what we wanted to include, how in-depth we wanted the service to be, were we able to do a website. So in researching, I looked up best practices with national organizations, NADTC, which was CST prior, Easter Seals, National Center for Mobility Management, and actually the Iowa DOT had a lot of good information on mobility management. And I just literally typed in mobility management in Google and took off on that. We also had to go over our budget, realize what our technology needs were, and to develop a branding and marketing plan. Next slide, please. So this is an overview of what we've developed. A toll-free multilingual phone line, and AAA has a contractor that they use for this, and whenever we use the multilingual line, we are just charged each time we use it. We provide live transfers to providers if necessary. The rider only has to give their information one time. We wanted an interactive website where people could search for providers, request a ride, and get information. We do cover here at the Area Agency on Aging 1B 6 counties. Starting off, we were only able to launch My Ride 2 for Oakland and Macomb counties, 2 of our counties, because those were the service areas of that public transportation provider. And we also wanted to keep our roots of older driver information and driver safety, so we wanted that to be a part of it. Now, we don't supply any transportation directly. We are just the connection to that, and we delve in a little deeper than just the ordinary information and assistance of, here's your phone numbers, here's your options. We actually dig in, find the best transportation for that particular situation. We'll calculate the mileage. We'll get them an exact price. We'll pre-call the provider to make sure they can handle that. So we really wanted to provide detailed options. Next slide, please. So there are several important factors in developing this. In the beginning, AAA 1B was essential in providing in-kind as far as administration, space and utilities, tech needs, etc., which you can see listed on the slide. So that was all crucial to us being able to get this off the ground in a costly manner, a way that we could manage. We do now pay rent, and we pay our tech and the utilities on our own, and we do finance some of the admin and the various departments. And we took a lot off of our current Information and Assistance Center, and one thing that was actually really, really helpful was a student intern, because we had a lot of, which I'll describe, a lot of things to do to get ready and to enter, and that was really, really important to this as well. For those of you, I think everybody should be familiar with Area Agency on Aging, and they have an information and assistance line through the Elder Care Locator, which routes them to the various agencies throughout the country. And all of them have this information and assistance resource center, and people call in for anything related to older adults and caregiving and family members. So we utilized our information and assistance infrastructure. We used the same system they were using to keep call records. We had to tweak it, and we had to add a page just for My Ride 2. And this system is also used for reporting, which I'll touch on in a couple slides. And we were also able to use their current providers that they already had in their database. And we were able to use their training guide as a template for ours, being that it was a call center and the technique would be similar. And we also reviewed how they vet the providers. Our Information and Assistance Center is AIRS certified, and their criteria is very extensive. We were able to add providers to our database without the same exact vetting process, which was helpful also. We do check and see if a provider is listed on our state's website, where they list companies that have applied for and have licenses. So that was helpful too, to be able to kind of piggyback on all of that and not have to do everything from scratch. Next slide, please. Decisions. So we worked closely with our communications department and Jewish Family Service. We bounced around names for the service. Should it mean something? Should it coincide with the phone number? Is there a domain available for the website? We went through at least 20, if not more, iterations of things that we had come up with, and I really wanted the phone number to match the name and to have it indicate at least what the service was. So in the end, everything that came together was My Ride 2, which I think of as My Ride also. So there's different ways to go about with that. We also wanted to develop a brand. So we hired a graphic designer who is actually a family of one of the staff. And something that this person does on the side, they do it for payment, but they do it on the side, so it's a little more affordable. You could also possibly use some students for a contest maybe and help developing a brand or a logo. And for our web design, we had an idea of what we wanted, and that actually changed as we met with the web designer. It's different, they viewed things differently, or this would be easier, etc. Next slide, please. So the results of that were, it'll come up in a second, My Ride 2, our logo, our tagline, connecting seniors and adults with disabilities to rides, and our website and phone number at the bottom. So this is what we ended up with. We decided on this, and to do this, we did show these to various staff members. We showed them to our advisory board. We showed them to Jewish Family Service, and we have a group here that is disability focused, and we showed it to them to make sure that it kind of resonated and it looked good and it fit. So that's how we came up with that. Next slide, please. So our next steps, we had that settled. So then we needed to research providers, both public and private. We did use, as I said, our current information in our Information Systems database. But literally, again, we would Google. We would also get information from other organizations, the Jewish Family Service, any other organizations. Literally, if I would see something driving down the road, I would say, oh, do we have them, such and such in our database, and check that out. Again, vetting them by making sure they were licensed. And we also had to enter the providers into an Excel sheet, as well as WordPress, which is how our website is based. So that was very time consuming. That's where the intern came in really handy. And also research zip codes for a service area and put that into an Excel sheet for the web designer to use for the search feature. So those were pretty big time-consuming activities. I also wanted to hire and train staff. So in addition to myself, we started with 2 part-time mobility specialists, Right now we have 2 full-time mobility specialists and a part-time person who works on the other grants. And we're soon to add another full-time, so we will be 3.5, including myself. We have also partnered with our local Center for Independent Living, and we do pay them a stipend, and once a week one of their staff members comes to our office and actually takes calls as well. And that frees up time for the other mobility specialists to do some quality calls and make sure everything's up to date. We also had to add our MyRide pages to the INA system and complete our website. Next slide, please. So this is an example of what we send to providers when we are asking them if they want to be included in our database. We send this information out. We take out the licensing part for them. They fill this all out, or if we have found the information on a website, we still want them to verify. We may say, can you verify that your website information is up to date? So we send that out. Next slide, please. And this is an example of our initial call worksheet. So when a call comes in, this is the information that we take down. We have been doing this by hand and then entering it into the AAA-1B system because that system is cumbersome and you have to move around to different pages and it's a little difficult to do right while you're on the phone. We were also recipients of a Veterans Community Living Initiative grant, and that was to purchase scheduling software. So we are in the process of obtaining that. While we may not schedule right away for providers, this is enabling us to get all of our information into our own system and not rely on the agency system, which was clunky and not user-friendly for what we wanted. So these are the types of things that we ask on every caller. You'll see on there, is the rider enrolled in the My Choice program? That's a program we have here in Michigan. And if they're on Medicaid in our county, they need to call a certain company. We can assist them with that scheduling. Next slide. And that's further on the page. I just wanted to make it big enough that everybody could see it. And you'll see number 15 up there, is it okay to share your information with providers? We did want to ask that question, and while the Area Agency on Aging 1B is a HIPAA organization and has to follow all the HIPAA rules, it was determined that MyRide 2 is a hybrid entity and that we are able to share this information with the providers without getting into HIPAA regulations. Next slide, please. And again, this is the bottom of the page. Special call notes, calculating mileage, writing the providers and their prices below, and the status and follow-up. And Harmony is the system that we use. That's why that's on there. Next slide, please. So this is our website that's going to be coming. Jeff, I'm just seeing a blank slide. I don't know if everybody else is just seeing that.
Coming up.
There it is. This is our website, that we use an outside contractor to use. If I was giving advice going forward, there are some of these pages that we can edit ourselves and some are not. It would be really helpful and less costly if you would work with someone who would allow you to access all of the pages and change them yourself. For instance, this first opening page, we are not able to change that. We have to have the web designer do that. And you can see in the blue tab, click here for driving tips and how to help an older driver. The other tab about mobility management. That part about learning to ride the bus is simply directing them to the public provider's website and the information that they have. And click here to learn about the Regional Transportation Plan, which is underway, hopefully. On the lower left, it has request a ride online. We have not, probably, I would say, less than even 10 people that have requested a ride online. So we are taking that part off and transitioning into promoting our travel training service. On the right, on the bottom, it says find a ride provider. If you all want to play on the website and go to it, you can enter the zip code 48076, and it will pull up options available depending on what you've clicked as far as the door-to-door, special needs, etc. And we have another lesson learned. First of all, we had everything coming up alphabetically. And then we rethought that we wanted the low-cost options to show up first at the top. So now it starts with community options available, then it goes to our paratransit service in the area, then to fixed route, and after that, then private ones come up alphabetically. So that was a lesson we learned on that. The providers we can update. We are allowed to go into WordPress, which is the site, the way the site's set up. And we can change that, update providers, remove them if necessary, update their information, etc. So we can stay on top of that. Next slide, please. What's coming up will be an example of our rack cards that we developed, and they're just kind of a heavier, not cardboard, but heavier card stock. This is the front and the back of that. And we worked with our communications department to also develop something that we could hand out, something physical that people could hold or put on their fridge. So the agency had used rack cards before, and they found them effective. So we went with our communications department advice and developed these rack cards, again, utilizing the graphic designer to do this. Another cost-saving measure that we found is that the agency uses a set printer who develops all the stationery and the cards and everything that they do. In researching, I was able to find different print companies that would do this at a lower cost than what we were getting, and it was very easy to do online because I had the information from the graphic designer. I was able to just upload it and have them printed and sent out. So that was good as well. These also are perfect size to put into envelopes if we're mailing them out. Next slide, please. We're going to go on into marketing. So initially, we developed a cover letter about this new service and who we are, what we did, what we didn't do, and we sent that out with a stack of rack cards to senior centers, to physicians' offices, hospitals, other human service organizations, and libraries. We also were able to utilize the agency, which has newsletters and various publications that they promoted the service in. We also submitted it to each little township and city has their specialized news insert just for them around here. So we developed a little article for that to be included. And we also utilized our partners to disseminate the information. And we did at one point have a radio spot. We sponsored, it's called a Living Well spot, and we sponsored that, and it was on a station that we know usually older adults listen to, and they get a lot of their information from that, so we did that. Word of mouth also was good as we got rolling. And social media, we don't have our own Facebook page. What will happen is if we want to promote My Ride Too, or if we have something coming up, the area agency on aging has a Facebook page, and they will just include a little blurb about us every once in a while, whatever I submit or if we have something special coming up. So we found that seniors in particular like something physical that they can hold, that direct mail is usually better for them, and that seems to get better results. The best results that we have received have been from those mailing out to the senior centers, and also the radio spots actually, and our agency quarterly newsletter that goes out. Next slide, please. So I want to talk about community partnerships next. And as you can see, stronger together, right? Next slide, please. So some partners along the way have been obviously the Jewish Family Service, our public provider, the Disability Network of Oakland-Macomb, which is the group that they send someone to come once a week, the Senior Alliance, which is our Area Agency on Aging 1C, and we developed a partnership with them as well, where we are handling their transportation calls, and they are promoting us in turn. We did try to set it up a little differently and have them take calls on their end. It just didn't work out, so we settled on this partnership. Advocacy groups, AARP, our Michigan DOT, Community Transportation Association of America, the local Metropolitan Planning Organization, some faith-based groups, healthcare organizations, and the Regional Transportation Authority of Southeast Michigan, which has been developed in Southeast Michigan, and we tried for a millage to get that supported and have our services be truly regional. Unfortunately, that did not pass, but they're still not giving up. So from that gathering together and collaborating to help get the millage passed, we did develop partnerships with the faith-based groups and some other groups that we might not have thought of to connect with, the business community, the cultural and sports institutions. They all have a stake in transportation in general. And while this wasn't focused on seniors necessarily, in the big picture, it did increase the options for seniors because it would automatically expand ADA around the fixed route, and it would automatically, not automatically, but it would also add more paratransit. We also, the past 2 years, I believe, a group of us in Michigan, we kind of got to know each other from different meetings that we'd show up at, and we developed an informal group of Michigan mobility managers. We meet every other month on the phone, and we just update each other on what's going on. Not everybody on the call is a mobility manager per se. It's people from transportation companies, and public providers. So it's a variety of titles, but we all do mobility management in some way. And that's been very helpful also. Next slide, please. We're going to talk about reporting and the kind of data that we collect. This is an example of an executive summary report, which we get from the reporting from the system that we're using to input. So as you can see, we track number of requests, unduplicated callers. When we have the number of INA referrals, we're talking about the people that are already in our INA database. We also track, as you can see, unmet needs, purpose of the call, and we send this to our public provider who is funding us through the 5310. We send them a monthly report on this. We send it to some of our partners and the MPO. The total results are included in agency reports, and we have sent this to elected officials as well. What we're most pointing out is in the volume of calls that the service is needed, and also we want them to focus on the unmet needs. If they say you know, oh, there's X amount who need to cross the county lines, which is an issue here. Maybe they would consider partnering in different ways to get people across the county lines. Or maybe they need to have weekend service or evening service. So that gives a basis for them to see what's going on, and it gives us ways to evaluate what we're doing as well. Next slide, please. This is a continuation of that because it didn't all fit on one page again. So in addition to this report, we also do a yearly evaluation. The first 2 years we did contract that outside, which was costly, so we decided to do it in-house after that. We do random quality control calls throughout the year. Right now we're taking every 20th call and calling them back for information. Another lesson learned, if we do the yearly evaluation and try to select callers, if it's too late, they really won't remember, you know, what they called us for if they used the provider. So we found it best to now do the every 20th call. That way they can, hopefully it'll be fresh in their mind. And we also, as I said, do the full evaluation at the end of the year. Next slide, please. So this is how we envision and we're doing mobility management here. And it is all that we're encompassing right now. So we have, of course, our mobility management, our mobility options counseling, driving, retirement. We have our transportation referrals, which is what we're doing when we find the options. We hope to schedule rides with a variety of providers in the future. We also, as I mentioned, are starting travel training with our grant from NADTC, and we will be, we have had one class so far, and we're going to launch that, and we're going to sustain that in the future through 5310 funds that are going to be distributed now through our Regional Transportation Authority. So we have already asked for or let them know that this is a new service and we will need additional funding to continue it and that we would like to continue it. And advocacy, which is always important to, again, let the elected officials, let the funders, the public transit providers know what we're doing and to advocate for more services for our older adults. Next slide, please. So our future, I talked about the travel training, and along with the RTA 5310 funding, they would like to have a true regional one call, one click, and they have asked us to expand our services into the Detroit service area. Technically, this is another area, Agency on Aging service area, but we are partnering with them to utilize their resources to have them promote, and that's where I'm going to be hiring another full-time staff person because we'll have increased calls. They are going to be housed here to have a hub, and we will pay the other area agency to do promotion and marketing and some admin costs. We also are talking about expanding to other Regional Transportation Authority counties. I had a call the other day about that, and I said I would love to do that, but not now. Let's see how the Detroit expansion goes and possibly after that. And as I said, our travel training. Scheduling software. Next slide, please. And my advice, and Virginia knows this, I probably include this in every presentation, is network, network, network. Get on every mailing list that you can get on, even if you don't. I'm on the rural transportation one, even though that's not where I'm serving right now. I like to stay abreast of what's going on. Mailing lists for grants of any kind, different organizations, with the FTA, with NADTC and National Center for Mobility Management. You never know what's going to come across. There may be some grants that you're qualified to apply for and you don't know about it. So I get on all the mailing lists I can. It can't hurt. I also attend meetings on transportation whenever I can. Meeting with our metropolitan planning organization, whether it's meetings with, there's a homeless task force that's focusing on transportation. I'm part of a state group that is on older drivers, but also, obviously, as I said, transfers into transportation. So really get involved and sit in on planning meetings on all levels. You could also attend coffee hours that elected officials have, attend their meetings. For our county commissioners, they have a set time when they have their meeting for public comments. And I have gone there and told them what we do, why it's important, and the need to support that in the area. Also, with elected officials, data is helpful. Look at all these people we are serving in your county. Look at what they need. So that's helpful. A couple of questions that came across earlier are, what are the best practices for increasing the number of persons with disabilities who use public transportation? I think the travel training will be an important step with that. We also have had what we call field trips, where we take a group just on the bus, maybe to get something at a coffee shop and come back. But definitely the hands-on portion, I think, is the best. There's talk about first last mile solutions. I do want to talk about Uber and Lyft because I think they're important options. For seniors, there is a website called GoGo Grandparent, and what they do is they utilize Uber and Lyft without someone having to have a smartphone. So, for instance, I could call up and set a ride up for my mom or dad, and they also will let you know, picked up mom or dropped mom off. So that's how we utilize those. We do offer them as options. Obviously, right now, or not obviously, but in our area, they don't have any accessible vehicles for wheelchairs. So that is something that we can't recommend them for. For rural issues, we do have rural counties, although I'm not serving those counties directly. But there is, Virginia mentioned the National Rural Transit Assistance Program, the RTAP, also Community Transportation Association of America, CTAA is helpful. And next slide, please. So it's time for questions, I believe, but I'll let Virginia handle that. There's my phone number and my email address. Feel free to contact me anytime. I'd be happy to help you in any way that I can. So I'll turn it over to Virginia.
Roberta, thank you so very much. You have really shared a wealth of great information. At this time, we're going to open the webinar up for questions, and those of you who are on the webinar itself, you can use the chat box to write in your questions, and we'll try to take as many of those as possible. But at this time, I'd like to turn it over to the operator, who will be providing us with instructions, those of you on the phone, as to how you can ask a question.
Virginia, if I might interrupt. Virginia?
Sure.
If I might interrupt for 1 second. There is a question I see in the chat box of what scheduling software are you looking to use? Yeah. Since that was also passed through the public provider, they had a certain procurement process that we had to go through. So we did go through a bidding process on that, and we ended up with 3 that came to the top. And the criteria along with the pricing, one that fit was actually a local company, and they're actually working with the military on scheduling software for them, and so they're developing that for us.
Okay. And Roberta, I don't know whether you're comfortable with sharing the name of that local company or not.
Sure. It's called Kevadaya, Kevadaya. We call them KVD.
That sounds like a good solution. KVD. Okay.
And they're in Pontiac, Michigan.
Pontiac. Okay. Thanks. So, operator, Melissa, would you like to provide instructions for those on the phone who may have questions?
At this time, I would like to remind everyone, in order to ask an audio question, please press *1 on your telephone keypad. That is *1 to ask a question.
If there are no questions right now, I can address some of the other ones that were sent ahead of time.
Sure. Go right ahead, Roberta.
Okay. As a call center, what do you consider your 3 best tools, services to the community? First off, but what we found is providing information. There's definitely a lack of information on options available. Also, helping people navigate even the paratransit service. We also help fill out ADA applications and explain if you're eligible for that and what that is. And I think advocacy also is important. And if anyone has a question while I'm talking, go ahead and interrupt. Let's see. Another question was first last mile we discussed. How can you trust the information you receive? That's where the checking if they're licensed on the website, on the state's website. We also, there are some legal issues on our website. At the bottom we have a disclaimer statement saying that we are not responsible, if they actually use the provider. We are just recommending, we are just giving them the options. It's up to them to choose who to use. We also, when we did the initial call sheet, you saw that we asked them if it's okay if we share their information with providers.
And to clarify, Roberta, you said that you check to see when you are considering putting a provider on your database, you check the state database to make sure that they are licensed. So
correct.
Unlicensed providers are not included, or how does that work?
They are not included unless they are a volunteer organization, or we have, and someone's on the webinar from this organization, Freedom Riders, that utilizes volunteers, and they are part of our resources offered. But if they're strictly a private provider, we make sure that they are licensed. And the state does all the vetting for insurance and things like that.
Okay. That's great. There is a question that just came in the chat box about your services being wheelchair accessible, and I know that you pointed out that you don't provide services directly. I guess the question is, do you connect people who need wheelchair accessible transportation to services that meet their needs?
Definitely, we do. We have, and as we've grown, and as I've been fortunate enough to have the same staff, they are very familiar with the different providers and what services they can and cannot provide. We receive quite a few requests for stretcher service and oversized wheelchair access, and there are people in our database or companies in our database that will accommodate them.
Okay, great. And another question in the chat box is a question about the type of insurance that you carry.
We do not carry any insurance from MyRide2. We are under the umbrella of the agency's insurance, their liability insurance. Okay.
And as a non-provider of services, you don't have to worry about that that particular aspect
Correct.
of insurance. Okay, thank you. Another question in the chat box. Once the grants you receive to start services are exhausted, how will you sustain? I think that's a great question. I've heard you talk about how the many years that you have worked on this issue, Roberta, you have been very diligent and fortunate to get a number of grants. So I'll just let you answer this question about what you do when no grant funding seems to be forthcoming.
Very good question. And we did have, I believe, it was probably a year when we were not grant funded, and actually we took a little hiatus in there. But we have definitely, we are definitely aware that any funding that we get is not guaranteed to continue. Right now we are utilizing the 5310 funds, and it has been a benefit to us to have the Regional Transportation Authority being the recipient and then the pass-through of those funds. I also am very budget conscious, and because there's a 3-year spending period on JARC New Freedom and 5310, I've been able to carry over funding to make sure that we are covered. And right now, and I always say this to the people at the agency as well, right now we're funded through fiscal year 18. As far as after that, it's up in the air. Hopefully it will be more 5310 funding, and we have shown the work that we do is valuable and it's needed. And we also, as I said, have received other grants throughout the year which share the burden of some of the salaries. So that means we can kind of save on that of the 5310 funding.
Are you still using a student intern at all?
We are not. That was just for the beginning, and then we actually hired her part-time to start.
And one more follow-up question. This is Virginia. You mentioned when you were talking about the different funding sources that support your program, you were mentioning a state of Michigan fitness organization as being one of your funders, which seemed to me to be a very creative, kind of out-of-the-box kind of funder. Have there been others in the past, such as that you have been able to tap into?
That one was very interesting, and in actuality, and this is also from networking, they approached us about they had funds that they wanted to use to specifically get information on older adults. And that was a $7,000 grant that, again, we utilized to do some surveys. We took some seniors on field trips. So that one was unusual. Sort of different places to look would be a community foundation, which is not necessarily transit focused, but more on health. And there are also the Rides to Wellness grant is an example. We are not a recipient of that, but our state DOT was. So it's important, and that's another reason to stay kind of on all these lists, is you never know what's going to come about, and you can make your case to, look at all these, riders we've connected so they can get to their medical appointments. So there are a lot of different ways to, to maybe make your work fit in with what a grant is asking. Does that make sense?
Yeah, great answer. Do you coordinate with volunteer agencies that serve particular target populations? So are there any volunteer transportation services in your community that you refer people to?
There are some with the Kidney Foundation and with a local cancer organization in the area, and also a veterans organization that we do have as resources. There's a couple of them that are small operations, and they just personally do this with funds from however they gather them. And they've asked us not to be on the website, but they are there if we need them. There's one particular person who only does veterans, and he is just a one-man operation, so he has asked that we don't have him on the database, the public database. But we do certainly have them in our database, and we also are anxious to, hook up with them whenever we can to utilize. There's also a faith-based organization that we work with, volunteer groups that drive that we work with closely.
Okay. And do you ever get questions from people who are seeking rides, like, for example, to attend worship services or to do some things that are not necessarily within the scope of services that any of these specialized transportation services typically provide?
Mm-hmm. Yes, we do. We do get some worship services. We have a success story I like to tell is how we helped a couple attend their niece's wedding. They wanted to go from their home to the wedding on a Saturday, to the reception after that, and then back home. And we were able to work with different providers and get that arranged for them at less costly than I think they were expecting, so which is always good. And just the coordination of all that, the picking up here, dropping off here, another pickup here, and just this week, we were able to help a gentleman who actually lives in Muskegon, Michigan, which is northern Michigan and not in our service area, but he was at the University of Michigan Hospital, and he needed a way to get back to Muskegon, and he needed stretcher service. So our state Office on Aging reached out to us because they know that we work with transportation, and we were able to find a service that would accommodate him and take him that long distance. So that felt good also.
Fabulous. One of the other questions that had been sent in was a question about walk-ins or face-to-face interaction. And a specific question about communicating with people who are deaf or hard of hearing when staff are not trained in sign language, ASL. Have you had those kinds of situations, and how have you been able to handle them?
We don't have walk-ins. We would not oppose walk-ins, but we haven't had any. Usually, and the way that most seniors like to connect is over the phone. They don't like to use the website, although more and more seniors are becoming tech savvy. Most of our calls, most of our information seeking comes through the phones. I have gone out and presented to deaf groups in the area or hearing impaired groups in the area. And actually that was speaking about older drivers, which I still do, but also now I throw in, but we have this service to help you now. And they supplied the translators there. When we had a big event, when we were getting together to hopefully get the RTA millage passed, we didn't hire, the Deaf and Blind Association here offers interpreters for free. So we did have them come and interpret the entire meeting and presentation that we had. But other than that, no, we do not.
Okay, thank you. I think we've got another question on the website that Jeff is trying to get to me very quickly. Go ahead. Well, he's still working on it. So
okay. I think I can see it here. It's what age group are you considering seniors? And I think that varies. What we're defining it for My Ride 2 is 55 and older. But we also assist the caregivers and the family members and any age adult with disability. So any 18 and older with a disability. And we also have a lot of calls come in from social workers or hospitals and medical staff as well. Generally, we actually really don't kind of turn people down. If they're calling, we generally help them, even if they're not, in the 55 and up category.
Okay. Let's see. So how have you been able to work with elected officials to get them to support transportation issues in your community? You may want to talk a little bit about your effort last fall to get a millage passed to support the regional transportation concept.
Yes, it is difficult sometimes, not impossible. We did find 2 ambassadors who were very supportive. Actually 3. One was one of our county commissioners. The other was a Michigan State representative at the state level, and then we also had a senator at the federal level. So in working, that was very vital to get other people involved. I bring up data all the time, and again, if you can bring data to any elected official and say, look, this is the need in the community, this is what seniors are asking for or need. Seniors are a large voting bloc, as we know, and we can also get into it to the elected officials that way. We did have a situation when we were doing the RTA millage and hoping to get that passed with one of the county commissioners who had agreed in theory 2 years ago that this would be great, who then started trying to back out, saying that they don't need that in their community, really was not supportive at all. And we were able, with our partners, to throw together really in one day a press conference. That particular commissioner was trying to not even have it on the ballot, and we very quickly gathered and had a press conference at a local church, and we called the TV, we called out, anybody that was on a press list, and we did have coverage on that, and it did, I don't know if that, I'm sure not that directly or by itself, but it did get overcome and it was on the ballot. But it's very hard, and I think that part of that is where that 0.5% loss was, because we have a city-suburb kind of divide still. And I think that, it's looking at the greater good. We all support our zoo regionally. We all support our Institute of Arts regionally. And people just, it's going to take some time. But we did have one of the county commissioners actually take a ride on the bus and go pick a destination and go, and had press tag along with her. So that was helpful as well.
Great, thank you. I just want to turn to Melissa for a second. Melissa, we've still got a couple of questions that have shown up in the chat box. But I wonder, is anyone waiting to ask a question on the phone?
There's no audio questions at this time, but if you would like to ask a question, please press *1.
Thanks, Melissa. Okay, next question, Roberta. How do you prioritize which services would work best for the client when you're coordinating a trip? What are some of the factors that you consider?
Some of the factors that we consider are covered on that intake sheet that we fill out. We can rule out automatically some providers if wheelchair service is needed. We can rule out public providers if they need to cross a county line. We can rule out local senior center community vehicles if it's going to go more than a few miles. And the software that we are getting is going to prioritize automatically and match the top 3 options with the rider based on the criteria that we will type in, and that will sort of connect with them. Really the best thing right now has been, again, that I've had staff that fortunately have been here, and they, after a while, you just know that, XYZ provider will easily accommodate this person, and they're lower cost, and they're the best option for what is needed.
Okay, great. Now, this is a question that may be a little bit out of your bailiwick, but it just came in on the chat box, so I'm going to ask it. Can you recommend a way to address liability concerns with volunteer groups?
Yes, you're correct, Virginia. It's not, we don't have a particular volunteer group here at the agency, so that is all handled by whatever organization is housing the volunteer organization. And here in Michigan, we have no-fault auto insurance, and what that means is, well, it's not technically no fault, but it's higher in price, and it's automatically, everybody has to have it and you're covered. And the way that the Michigan insurance is, if you were a passenger, for instance, in my car, that you would be covered the same as I would in my vehicle. It also, I believe they made a concession for volunteer drivers at the state level, but I don't know for sure.
Okay, thanks. I would say to Daniel H., who asked this question, a couple of things. One is there is a National Volunteer Transportation Center that has a website that's a great resource for information. And in addition to that, and I think I'm pretty sure they've got this information on that website, there is an insurance organization that specializes in volunteer insurance called CIMA, C-I-M-A. So you can Google that and I think find that information. They're very good with not just talking about insurance and insurance products that can be purchased in the event that you're using volunteers, but also some of the policies and practices that you utilize in the volunteer program that ensure good protection. So those are two good resources, I would say. And finally, there is within the Aging Network a National Volunteer Assistance Center that is targeted primarily to area agencies on aging and state offices on aging. But you can get that information if you Google that as well. So if you want to know more about this, just send us an email, Daniel, and we'll see what we can do about putting together these resources for you. I don't think we've got any questions right now in the chat box. We're getting close to the end of the call, but I did want to throw out maybe a couple more questions, Roberta. The question is whether, how often you receive requests for same-day rides and how you are able to accommodate those. Are those just impossible to accommodate, or are there particular riders in your ride services in your system that can take care of a request such as that?
We do receive same-day requests, and there are different providers that can accommodate them, so we hook them up with that. If the paratransit service, you can register 7 days ahead of time or schedule a ride, but you can only have a 2-day window to accommodate any other trip. So we actually start with that service because it's lower cost and they may have cancellations, so we actually will check that. But we do have different providers that we can call on and that can accommodate same day.
Great. This is sort of a loaded question, and I'm just going to throw it out, Roberta, and you may not have a number on the back of an envelope somewhere, but it's a question about the cost for setting up a robust mobility management portal.
I can tell you what we started out with about a $63,000 grant, and fortunately we've been able to grow as our service grows, and we've shown a demand for that. Currently our expenses are running probably $150,000 to $175,000 a year.
Great answer, thank you. And this is going to be the last question I'm going to ask, unless there are more questions that show up on the chat box. As a call center, what do you consider your 3 best tools?
first providing the information in itself, and other than just providing the information, as I said, really digging in to the need and the request, and not just saying, here's 3 numbers you can call, calling ahead for them, making sure it can be accommodated, really researching different creative ways that it might happen, such as using some of those in our pocket volunteer services. So I think that's really the best thing, the best tool we have. We also help people, as I said, fill out ADA applications. We'll print it out, highlight where they need their doctor and their information to sign, mail it out to them. So we actually will call the connector service, the paratransit service, and register them so they don't have to do that. Then they can just call for a ride. Also, advocacy, I think, is something that is one of the things we at the agency, as well as us in My Ride 2, have done. That's been really strong.
Great. Thank you. And any last words, any final words that you'd like to say, Roberta? Feel free to share it at this point.
Well, again, thank you for having me on this webinar, NADTC in Virginia, and I have enjoyed my time chatting with everyone today. And again, I am very happy to help in any way that I can. If there's something that you wanted more information on as far as our reporting or anything, feel free to email me, and I will get back to you with any information that I can.
Okay. Thank you so much, Roberta. We are so grateful to you. You've been a great presenter, and you've been very generous with your time and your thoughts and sharing responses to questions that people have raised. I want to say again that if we didn't get your question, I know that we had a few questions about rural communities that we will attempt to respond to. And Daniel, again, if you want to send us an email with your questions about volunteers and liability insurance, feel free to, and we'll be glad to send you those links to those websites. And any other questions that we may have just not gotten to, or that you want to know more. And you may have questions that occur to you after you hang up. And we just want to say that the door is open. If you have more questions, you certainly could get directly in touch with Roberta. And the last slide here is our contact information. We hope that if you're not already getting our e-news, that you will sign up to get it on our website. We really appreciate the opportunity to be with you this afternoon. And again, thank you, Roberta, for a fantastic presentation. I also want to thank our operator, Melissa, and our captioner for helping to make today's webinar possible. And finally, I don't want to forget that your feedback is really, really important to us. We use it to prepare for future training events. I think I mentioned at the beginning of this call, we've got 3 blog posts currently about information and referral on our website. We have at least 3 more that are in the hopper that are planned. But if there are particular issues that you'd like us to address, if you'd like to suggest another webinar on this topic, you feel like there's something else in particular that you want to know more about, we hope that you'll get in touch with us. We really want to listen to you and plan our future events around what you want. You will be receiving a short, multiple choice evaluation on today's webinar. We hope that you fill that out and feel free to share any additional comments with us. And lastly, please remember that the NADTC is a resource for your programs and for your accessible transportation needs. So we hope you've already looked at our website at www.nadtc.org. We invite you to check out our Facebook, Twitter, LinkedIn, and YouTube accounts. And please remember, again, to sign up for our e-alerts You can reach us via our toll-free line, 866-983-3222, or email us at contact@nadtc.org. And again, we welcome your continued questions and issues that you'd like us to work on. Thank you again for joining us today, and we hope that you'll enjoy the rest of the afternoon. Bye-bye.
Thank you for joining today's conference call.